I don't know about you, but if my family member is in the hospital in the American healthcare system, I'm most likely on the phone with them on FaceTime, waiting for a physician to come in or the nurse to see what's going on, what's on the IV pole. I'm watching, I'm listening, and I'm advocating for my family member. My family is Dominican. Most of my family is black and brown. I am the most palm colored of my family members, but all of us work in healthcare. Mainly because if you are Dominican in the US, you are going to be getting a degree in healthcare and you're going to be working in healthcare in some way, shape, or form. The decisions are made for you at birth. So I do not make the rules, my abuela does. So that's all I have to say about that. If you are a healthcare worker and you're confused as to why black and brown patients are having care conferences on FaceTime with their family members while in the room with you, asking for advocacy from their family members, having a witness in their care, it is because they have been betrayed by this system, by healthcare workers who do not deeply understand their care needs and don't care to learn. Is this disrespectful to the provider? I would say no. The context here is that these patients have been dismissed and disrespected and felt unheard by their clinicians over and over and over again. So they have someone there to witness the care that they receive, to listen for them, and to ask questions they might be afraid to ask because they haven't established trust with you yet. I'm a nurse and I've seen it for the patients that I care for. And again, a lot of my family works in healthcare and they've seen this as well. When anyone in our family is in the hospital, everyone is on high alert and everyone is in the room or on the phone trying to listen and trying to advocate for their family member because they know that their voice is not enough to ensure safe, high quality care. And even then, it's often not enough. A tragic and recent example of this is Nurse Eddie Bernice Johnson, who was the first nurse in Congress. Her family filed a lawsuit against Baylor Hospital saying that she died of medical negligence after being found sitting in her own stool and urine days after a spinal cord surgery. As someone who had a lower back surgery last year, I can only imagine the pain that she was in and the lack of dignity that she felt in those moments and how her family felt having to see her in that state. And it led to a domino effect of harm that often impacts black and brown patients more so than their white counterparts. Maybe if we actually listen to our patients and try to understand their perspectives and validate the experiences in which they lack trust when they are faced with the American healthcare system, we can begin to change our practices and become trusted providers of care. Instead of immediately taking things personally and making assumptions about our patients, we can begin to develop an understanding and work with patients in order to provide them the care that they deserve and that they deem necessary. We each have our own work to do in order to ensure safe outcomes for all patients. That means addressing our own internal biases and not making assumptions about our patients based on how they look. We truly cannot be advocates for all patients if we don't listen to the perspectives of our patients, their family members, and collaborate in the care that they receive, and also understand that we have the capacity for harm. Something that I learned while working as a nurse is that we can always do better.